Hello friends, if you haven't yet subscribed to the channel, it will be a good time to subscribe now. Hello friends, here is the reasoning question. Calcium deficiency does not result in clotting defects. Explain why. I always say for reasoning questions, there is a certain angle behind that question. Once you understand that angle, only then you are able to exactly answer that question. Otherwise, you will go astray. So let's understand the angle behind this question and then we will solve it. Right. Now, we all know that calcium is a clotting factor. Factor number 4 is calcium. We are aware of that. And therefore, calcium in the plasma is required for the process of clotting. Intrinsic and extrinsic pathways for coagulation, most steps require calcium. We are aware of that. However, the point is that calcium, plasma calcium, which is required for the process of clotting, is required in very minute amounts. Now, what is the normal plasma calcium? 9 to 11 milligrams %. All right. And hypocalcemia, that is fall in the plasma calcium as results from hypoparathyroidism, it will lead to tetany, manifestations of tetany, whereby you see involuntary spasms of the muscles, apart from other symptoms like carpopedal spasm, etc. So involuntary spasms of the muscles. And as the plasma calcium levels fall, 8, 7, when they go below 6 milligrams %, it results in laryngospasm and it will lead to death of the patient. Yes, below 6 milligrams % and the death will occur. Now remember, clotting defect it will not be manifested at this calcium level. Clotting requires very minute amount of calcium. It means before the plasma calcium could fall to that low level, the death would occur by tetany, that is laryngospasm. So in live human being, you would never see clotting defects occurring from the calcium deficiency or hypocalcemia, because calcium going that low will never occur, because before that the death will occur by laryngospasm. So therefore, calcium deficiency or hypocalcemia does not lead to clotting defects. So remember, reasoning questions always require a certain understanding of the facts. You knew the fact that calcium is required for clotting. You know the fact that tetany results from calcium. Only thing is, you need to understand what's the link and what is the angle of a particular question.